Hi everyone, I'm at the Cannabinoid Medical Clinic here in Midtown Toronto. This is the place I first got my prescription for medical cannabis in August of 2014, and today we're going to talk to Dr. Daniel Schecter, the man who gave me that prescription. Come on in. This is the exact chair that I think I was sitting in 4 years ago when I first got my prescription for cannabis. So thank you for that, and thank you for not laughing at me when I showed you the prototype for what's now Strainprint. In just a very short period of time here in Canada, anyone's going to be able to go, anyone over the age of 19 is going to be able to purchase cannabis legally in a store. And what can you tell our viewers, for people who are, maybe they haven't been able to get a prescription or been afraid to ask their doctor, what would be the difference between waiting and purchasing it legally as a recreationally or seeing a physician?
You have to ask yourself, why is it that you want to use cannabis? If it's just to use it recreationally, then absolutely. Wait till it's legal for recreational purposes, or we prefer the term adult use, and go to a store, buy it. If you're actually wanting to use it in order to see whether it could improve specific symptoms that you're experiencing or specific conditions, then I would strongly urge you to speak to your doctor around how you can best use and access cannabis to achieve the best symptomatic response, to get the best benefit out of using cannabis. If you're using cannabis to treat a condition, you might be on other medications for that specific condition. If you add on cannabis, you might get improvement in your symptoms and want to reduce some of your other medications.
Right.
And that's always best to be done under the guidance and with the recommendations of a doctor.
What are some of the most common conditions and ailments that you see come in here?
You know, over the past 4 years, probably the vast majority of patients who come to us come with the primary condition of chronic pain. So what we see in people coming to us who are living with chronic pain is not just chronic pain, but what we call a symptom cluster.
Right, that
makes
sense.
So pain with depression, anxiety, insomnia. And while pain is a primary symptom that we're targeting, secondary symptoms are just as important. So we tend also to have a big focus on sleep, mood, including anxiety and depression, appetite, and overall well-being.
For people that haven't really tried cannabis, could you tell them what would be some adverse effects that could occur, just certain things that they could look for?
When we're talking about cannabis, it's not a single product. We're talking about literally hundreds of different products with different ratios of THC to CBD.
Right.
And when we talk about adverse effects or side effects of cannabis, we're talking about the side effects that can happen with THC.
Got it.
Now, the side effects of THC are in what we call a dose-dependent relationship, meaning that the more THC you consume, the more potential symptoms or side effects you can have. The best known side effect of cannabis, or THC in particular, is obviously getting high or feeling impaired.
Right.
Now, some people experience that as an unwanted side effect, whereas other people who might have severe pain or severe anxiety will actually use cannabis specifically to achieve that sense of euphoria or being able to be distracted from the symptom that's really impacting them.
Sure.
The other symptoms of having too much THC, aside from feeling high or happy, hungry, sleepy, giddy, is obviously things pertaining to the physiologic effects of THC. And those can include a rapid heart rate. In association with that, you can also get what we call peripheral vasodilation, which is the dilation of your blood vessels. And that can lead to what we call hypotension, meaning a low blood pressure. So I'd say that Canada is at the forefront in terms of understanding how and why patients should be using cannabis, being able to evaluate them, and be able to provide proper recommendations and ongoing monitoring and follow-up.
Awesome.
When I talk to physicians in other countries, it's a complete black box for them.
Wow.
They have absolutely no clue about what cannabinoids are, why we would even consider authorizing them or suggesting them as a therapeutic option, what the physiologic basis is, which has to do with the endocannabinoid system. And when it comes to dosing, it's also a complete black box. They have no clue if it should be 1 milligram, 100 milligrams, if they should smoke a joint, take a vaporizer, use a capsule or an edible. They have no clue what products are out there. They have no clue about the regulations around how patients can access cannabis. So there's a tremendous amount of education that has to be provided to these physicians.
Wow, so we got a pretty big responsibility here to keep up that standard of learning so we can share it with the world, right?
Yeah, I think especially in the age of legalization for adult use purposes, Canadians are becoming leaders in medical cannabis, and this is intellectual property that we can really go out and share with the rest of the world.
As a patient, I could not agree more with that. I definitely could not agree. And I want to thank you very much for your time, because I know it's very valuable, and we look forward to spending more time and getting to know you better in the coming months.
Perfect.
Thank you.
Thank you.